The majority of men with erectile dysfunction are good candidates for penile implants. It really is going to be what's going to be best for that specific patient. We see that men who desire spontaneity, who desire ability to travel, who desire the ability to have sex a little bit more frequently, the penile implant works great. Then again, I have a number of patients that the penile implant may not be used as frequently as they'd like. However, it also helps the penis from retracting back in, so post-prostatectomy or post-pelvic surgery. And they love the fact that it actually makes it a lot easier for them to urinate, go to the bathroom. So penile implants are a great option for a number of patients. It's not the only option, but certainly something for us to consider in each scenario. In the majority of cases, insurance does cover penile implant surgery. There are a few exclusions out there, and that is something that our office staff can work through to determine if that's going to be specific for an individual patient. But most of the insurers, including Medicare, do cover the penile implant. In the United States, there are two primary implant types. There's a malleable device, as well as an inflatable device. Within the United States, the inflatable device tends to be the one that is used more commonly. There's a substantial difference between the malleable and the inflatable implant. The malleable implant is very simple. It is a rod that has a core that will allow it to bend into position. It allows enough stability for sexual activity, but also enough so that it can be bent down and hidden when patients are not sexually active. The inflatable implant, however, is really meant to function more like a man's natural erection. There's two channels that should fill with saline, and those channels fill the normal areas that would fill with blood during an erection. There's generally a pump that sits down in the scrotum, and that pump is going to be what transfers the saline from a little fluid reservoir that's tucked up behind muscle so it is not seen or felt. All in all, the malleable prosthetic works great for men who have some dexterity issues, but the majority of men feel like the inflatable implant really provides them with an erection that is much more consistent to what their natural erection had been. The implants are sized at the time of surgery. Unfortunately, there's not a good way for us to size them prior to surgery. However, to give patients an idea of how much length they will have after the implant's placed, we generally place the penis on stretch, and where we can stretch it is often where we're going to get as far as their erections go. Keep in mind, many men have already lost some size related to whatever was causing the underlying erectile dysfunction before we even get to the point of being able to put an implant in. I do reassure all my patients, however, I'm not here to take some off the top. Nobody's coming in asking for that. So we will maximize size and put in what is safe, as well as what will actually give patients the best cosmetic outcome. The malleable device is really easy to operate. It's literally just bending it into position. Now, for the more complex, which really isn't even that complex, the inflatable device, there's a pump. The pump sits down between the testicles in the scrotum. We do not have to take a testicle out. When a patient wants an erection, they would reach down, find the bulb of the pump, and squeeze. And it's a variable number of squeezes, but the squeezes will move saline into those cylinders. It is not going to be overinflated. Guys are not going to pop the balloon or the pump. They're going to keep inflating it until it's fully rigid and able for sexual activity. Now, when sexual activity is completed and they want the erection to go down, there's also a little deflate button there. And that deflate button will change the valve on the inside, which will allow the erection to resolve, go down, and have a much more natural, flaccid appearance to the penis, or flat appearance to the penis. Following a penile prosthesis implantation, men should have normal ejaculation as well as normal sensation. It really should be very consistent to what they had prior to the surgery. We don't see numbness of the head of the penis. We don't see changes in the ejaculation. However, some of the diseases that are going to cause trouble with erections, whether that's diabetes or prostate cancer type treatments, may change the ejaculation, may change a little of the sensation. Overall, however, patients are very satisfied with the sensation and the ability to ejaculate following surgery. Yes, the implant is concealed. In fact, from the outside, if a man was walking around the gym, nobody's going to be able to tell that there's an implant in place. Some men actually like it because it actually keeps the penis hanging a little bit better than it had pre-surgery as well, because with those cylinders in place, the penis is not going to be able to retract quite as much. But from outside the body, everything looks normal. The implant is made of a synthetic material that is exceptionally strong. It is made so that it will inflate primarily girth-wise while maintaining very good, strong rigidity so that the penis feels as firm as possible. It is not a material that can be easily popped. In fact, I tell most of my patients, as long as you're not sticking a needle in it, there's no restriction on positioning or activities that can take place. The solution in the implant is saline. Saline is a critical component of what's normal in our bloodstream, and therefore, if there were ever a problem where some of the material actually leaked out or where the device did have a malfunction, there is not a problem with the saline. The body will naturally reabsorb that saline, and there's no subsequent long-term issue. Placing the penile implant is a surgical procedure. It's a procedure for many patients that they can go home the same day. It's done in an operating setting because we want it to be as sterile and clean as possible. The procedure can be done through a number of different incisions. In fact, there are 3 primary incisions that are used, but the 2 most common are going to be a small incision right between the penis and the scrotum, or a small incision right above the penis itself. What we would do is actually go in, find the correct channels that should be what would fill with blood, and we actually slide a tube into those channels. That tube does not need to take anything out to fit into place, and actually will naturally then provide guys with the normal rigidity and strength of a typical erection because we're still allowing the body's natural strength layer to remain there. We don't have to take a testicle out. The pump will sit down generally behind the 2 testicles in the midline so it's well hidden. And as for the fluid reservoir, the reservoir will go up generally behind the bone, the pubic bone that's there, or even up under muscle, depending on what the scenario is, what prior surgeries the patient's had, as well as the patient's specific anatomy. The recovery for a penile implant can be a little bit variable. However, most patients are going to follow a very typical course. That course is that for the first couple days following surgery, they generally will have some swelling in the scrotum, some discomfort and tenderness, and that's generally going to be taken care of between the nerve block we do during the time of surgery as well as some medications postoperatively. Following that, many patients will have some swelling and potentially some positional discomfort that will continue to improve with time. For men with diabetes, the better their blood sugar controls are heading into surgery and following surgery, the less discomfort they'll have. In fact, their recovery is actually quite a bit quicker if they're having good blood sugar control. For most patients, however, by about 3 to 4 weeks out after surgery, they're ready to get started with inflating and deflating the device. However, there are a small section of men that it may take closer to 6 to 8 weeks following surgery to get all the swelling to go down to where they're ready to start inflating and deflating. On average, for most patients, they'll be able to start having sexual activity following penile prosthesis implantation approximately 4 to 6 weeks out from surgery. There are a few exceptions where men are actually even a bit quicker, or potentially even a little bit longer depending on a specific scenario, but the vast majority of patients by about 4 weeks are ready to resume sexual activity. The penile implants have undergone multiple changes since they were first introduced in the 1970s. Those changes primarily have decreased infection rates, but they've also really made sure that the implants are as reliable and structurally sound as possible. What we see is that at about approximately 5 years after implant surgery, about 95 to 96% of patients are still having success and have not needed any sort of revision or repair of the implant. We're seeing patients routinely get 10 years out, and in fact, at times we're seeing patients get 15 to 20 years out of their implants as well. Satisfaction rates with the penile implant are quite high. In fact, what we see is that over 90% of patients and their partners are very satisfied with the implant. The biggest concern we hear for a lot of men is that they feel like the size isn't what it used to be. And unfortunately, that's not something we can always overcome, because most men, when they've had trouble with erections, have lost a little bit of size. In fact, if I really had a way to make it bigger, I'd probably be on an island somewhere and not needing to work after I sold that idea. In all reality though, the vast majority of guys have more size than they actually need and get a great result from the implant. And once they start to get back to using it, realize that they've got exactly what they need, that it's a wonderful scenario for them and their partner. As with any surgical procedure, there are risks with a penile implant surgery. Some of the more common risks are going to be hematoma, or a little blood that'll pool. That blood is not necessarily a clot. That's not a clot that can go to the heart, but it's a clot that sits and requires the body to reabsorb it for the inflammation and tenderness to go down. We do worry about the risk of infection. Infection risk is going to be somewhere between 1 and 3%, depending on the scenario. Infections are thankfully much less common now, and we do coat the devices with antibiotics, but infections do, when they occur, do lead to problems downstream that require generally further procedures or at least intervention. There are risks of injury to surrounding organs, whether that's injury to the bladder, whether that's injury to blood vessels that are in the area, or probably the most common would be injury to the urethra or the urine channel for men. And there are ways that we can prevent that. And that's one of the benefits of finding somebody who does this frequently, is that you're going to have less likelihood for those risks to happen. Thankfully, we do not see the devices rejected by the body. We do see potentially over time that they may mechanically start to break down. But for the vast majority of guys, once the implant's in place and they go through the healing process, they actually do substantially well and don't require any further downstream treatments.